Second most important medicine for hair loss is finasteride. This medication is used to treat pattern hair loss in males, also known as androgenetic alopecia. One of the studies says that finasteride has 90% chances of treating hair losses, which is proved by the people who have experienced. Finasteride decreases the amount of unnatural body hormone dihydrotestosterone by preventing its formation from testosterone. Now, decreased amount of DHT would increase the hair growth on the scalp, reduce hair thinning, and gradually slow down your hair loss. Its side effects may be on erection, sexual desires or activity, and ejaculations. On the other hand, topical finasteride is available in the form of a solution or gel, and it directly targets DHT levels on the scalp after getting absorbed. Its side effects cannot be more than scalp dryness or irritation, unlike its oral dose. Take this tablet or apply as directed while not overdosing it. Hair shedding after taking finasteride means that the medicine starts working. It may take minimum 3 months to show the results. You may feel increased volume of your thick and healthy hairs. It works best for those who are early victims of pattern hair loss. For people with complete baldness, it may not be an effective way to use finasteride. Women, children, and individuals with liver problem are not advised to take finasteride due to abnormal growth and hormonal defects.